Hello, my name is Stacy Gonzalez. I am the Executive Director of the Healthy Community of Brookfield. Today's presentation will focus on the goals for our organization, and those goals over to create a financial plan to ensure the organization is well funded, create a strategic plan to incorporate community constituent partnerships, establish standard operation procedures to ensure HCB retain its accreditation, create a learning environment for employees, and create ethical policies to stop the fraudulent financial mishandling of grants, local and state financial support. Now, when we do the overview of the organization and the programs, Healthy Community Brookfield is a 501 nonprofit charitable organization. HCB was a visiting nursing agency called Brookfield Health. Brookfield was a department in the VNA contracted by the state. Its job was to manage intervention and prevention of cardiovascular disease and promote health program initiatives in Brookfield County, the city of Decorum School District, until 1997. In 1997, a benefactor donated $2 million to HCB to work as an individual contractor to work for health promotion and wellness. Now, as we see here, HCB has a number of various programs and services. Those programs and services are listed from nutrition education for children and teens to primary care for mothers and infants. And we also have a mobile health care service system, management and discharge services for the elderly. We have violence protection programs. We have a smoking cessation classes, diabetes classes, after school programs. And we also have a well water testing and water mitigation assistance. We have services for vaccine and immunization. And please be advised, according to the director of the health department, we failed our accreditation, and these services are in a process of being terminated within 3 months because of lack of funding, which I will talk about later. Now, there's a whole scope of factors to why we didn't pass accreditation and why we're having financial issues. Number one, the staff views the environment at HCB as a good place of work, but they do not feel secure in their work positions because we have a continued cycle of financial crisis. And because of that, it has affected staff ability to internalize the mission and values of the organization. Then we have an issue with our image in regards as to the political environment. We failed to meet the accreditation requirements. Constituents have no confidence in our organization because we appear to have no knowledge of healthcare programs, and our leadership is questionable. The board's relationship with the community and constituents is good. They do see us as hardworking and doing a good job, dedicated, and knowledgeable, but that's all based on our when HCB was a department at the VNA. Today, the HCB Board of Directors are being seen as the problem for our organization. According to the local state official and farmers, they are frustrated with the Board of Directors because they are continually demanding more money for personal program agendas. They're frustrated because their prices are being raised on well water testing programs, but they're not receiving the services. We are duplicating services from other constituent healthcare organizations. And like I said, although the community see us as doing good and hardworking, dedicated, and knowledgeable, they do not realize that we have failed to provide them a proper service. And in regards to our economic force, our programs are constituent upon grant funding. The programs and community support are vulnerable to closure. And because we have no solid financial plan, and we have it has affected us, and now due to the fact that without a financial plan or strategic plan, we have lost our accreditation. Therefore, we will not be receiving local and state aid. Now, we do have some strength. One is that we are a nonprofit charitable organization that promotes public health and wellness. We give several traditional public programs. We do have goals and vision for our community as relates to healthcare and the service that we provide. The staff is viewed as dedicated, hardworking, knowledgeable by the community, and the staff view HCBs as a good place to work, and our organization has invested resources into programs for the medical staff to deliver better services to the community. Now, in regards to our weakness, the organization was developed in 1998, but we have no strategic plan. And because of the strategic plan, we have a poor financial resources, And we have poured most of our financial resources in the medical program and not enough into the Brookfield community as we are ordered to do so. Directors and managers have who are continually seeking grants for their own personal gain. HCB is seen as an organization without a navigational system. I mean, we have poor leadership. Chief advisor has been appointed, but has not been able to budget money to keep the organization and staff and programs afloat. HCB is creating because HCB is duplicating programs for the health officials. It's thus creating unnecessary expenditures for them. Now, the opportunity HCB has because of their past relationship with the community and constituents and having a good representation of that, we need to take the opportunity to invest in partnerships with the constituents and the community. By creating a strategic plan to align us with constituents that share HCB vision can allow the organization's abilities to maximize abilities to integrate partnerships into our public health programs, creating more financial revenue to invest in other areas of public health, and allow HCB to implement creative ideas which can be adopted by other organizations and create long-term agendas for the organizations and relationships with constituents and the community, expanding on the organization's role in the public health community and building lasting relationships, thus creating a stronger future for HCB. It also will help us to get more money in regards to extra finances, because if we partner, we can save more money and put into training for our employees, and as well as create professional and creative partnerships with other organizations. By implementing a strategic plan focused on constituent partnerships and community involvement and learning environment, trained staffers, and environmental financial revenue will allow HCB to keep expanding its mission and values into other areas of the public health community in order to maintain accreditation, establish long-term goals, relationships that will revitalize HCB's reputation as an organization and leader in the public health field. Now, the threats that we are facing is that CDC regulations that the public says the public health agency needs a strategic plan in order to meet the public health needs or lose face in their accreditation. The board has mismanaged money, so now we are in a position where we could be audited for the misappropriation of funds and may be forced to pay money back. We have not created a strategic plan to reach out to other public organizations. Therefore, we put more money into programs that are already being initiated by other health organizations, and we're spending more money on programs that we don't need. And due to the lack of partnership and misappropriation of funds and failure to create a strategic plan, is jeopardizing HCB's ability to effectively deliver services to the community. As cause of that, it will cause the organization to close its doors because HCB lack of accountability and influence with other public health organizations. We're looking at possible areas that we need to focus on. We need to focus on creating partnerships with the community and constituents. By doing so, we are creating a structured economic improvements in the community. The organization will create also medical and administrative staff to identify areas in the community and health sector that need health promotions, and also help them to become more involved, the community otherwise, help them to become more involved in planning, designing, implementing, and evaluating appropriate programs for themselves, meaning have them take over their own personal care. Also, in our strategy, we need to implement rules and regulation in regards to behavior and ethics. We must create ethics to control all grant requests to ensure the money is actually going to the needed programs and back into our organization. We must limit the tenure of the board of members to avoid conflicts of interest issues. We must implement disciplinary action for those who do not comply with those regulations. And we must train staffers to replace leaders who may not be able to do their job and create standard operation procedures explaining the responsibilities and duties of all staff. Here we focus on the mission and vision of the organization. We strive to improve communities' health, strengthen quality of service, promote health and wellness. But our new mission statement should be focused on our strategic partnership with other health organizations to lessen the organization's financial burdens and have allocated funds to create a learning environment and to create programs to teach populations to take control of their own health. In regards to our vision, to improve health behaviors in individuals' community, our aspirations should stay that way, but focus on a more culturally competent strategic plan to help improve the community's health, but make sure that the programs are effective based on cultural behaviors and take those cultural incentives to encourage individuals and communities to make generational changes in order to implement better health and wellness. The outline for our organization is the first we have to do an organizational assessment. Assessment must be conducted on abilities of present leadership, examine voided engagement between the community constituents and programs that are in place that are being promoted by other healthcare organizations. So pretty much we have to do assessment of our infrastructure and our programs and services. We must make sure that the programs that we initiate are culturally competent. We must create a community partnership and allow the community to participate in our intervention programs. We must work with constituents to create a long-term partnerships in order to capitalize on our budgets and our financing. We must hire outside agencies to train our staff to explain to them their duties and responsibility, ethical standards, rules and regulations, and we must create a strategic plan in order to create a surplus and aid for other programs and to keep our organization afloat. Our expense budget is going to start with the $2 million was first given to us. Revenue generates to balance expenses needed or should be needed resources for effective delivery service. Now, due to the misappropriation of funds, as I've listed at the bottom here in regards to grants, local state aid, duplication of services, funds for personal agendas, deletion of cash, and no capital revenue, we must obtain a corporate account firm to analyze what the organization stands in regards to financial revenue and initiate cuts of programs and unneeded expenditures based on the report that they give us. So pretty much we're doing a historical budget analysis. After we do a historical budget analysis, we're going to look at our operation budget. The operation budget is going to consist of eliminating healthcare programs that are already being initiated by healthcare agencies. Now, presently, because we do not have any local state aid and no money coming through, we must cease to request for local and state aid and grants to order control over spending in every department. Now, in regards to our cash budget, presently we have $2 million, but it's actually being depleted. Presently, we need to borrow money from a financial institution to make payroll and ask for a 6-month probationary period to continue to obtain local and state aid to help us build up our cash revenue and create a cash budget to pay bills and staff paycheck. Now, when we look at our capital budget, it must remain separate from the organizational operation. Capital budget is for furnishings and can never exceed $500. Budget managers will project the capital needs for their department. In other words, I want them to give me a memo telling me exactly what their department needs, and I, along with the director of finance, will determine whether those needs can be met and whether those needs meet with the mission and vision of our organization. The implementation of this fiscal budget plan will ensure that HCB has a yearly surplus, which the budget plan quantitatively expresses the intentions, expectations, and actions of HCB in order for the organization to reach its financial goals each year. Meeting these goals will ensure that every department in the organization have a quarterly surplus every year, each year. Now, this is the expense budget, and expense budget also includes some of the deficits that we've been experiencing. When we look at the HCB, we see they didn't have strategic budget. We were given $2 million, but it's now basically depleted. And because we don't have a strategic budget, we are now looking at a high deficit. When we look at the program and services, we have 26 programs all duplicated by other agencies. We are in a process of losing our accreditation. And losing our accreditation, we have no local or state aid grants. Now, we have full-time staff, and they're about to be faced with income and lack of cash because we have no cash surplus. Loss of aid and grants means we have to evaluate operational, cash, and capital budget, and no payroll or equipment will be allowed probably for the next 5 years until we can balance our budget. Now, the board, and according to what the company accountants tell me, now as the board of directors have reviews local and state aid, calls organizations with accreditation and no training to manage health, and they have no training in healthcare. Local and state government will not give us money because of accreditation. we will lose most of our program in the next 3 weeks or months, and we have to close our doors and open layoffs.